So COVID-19 is a member of the coronavirus family, and coronaviruses are most well known for causing the common cold. However, COVID-19 is a novel coronavirus, meaning it's a new type of coronavirus that first emerged in late December, early January in Wuhan, China. And it's been responsible for the outbreak that we saw there and is now causing outbreaks all over the world, including the United States. So this virus is spread through direct patient contact, usually with someone who is sick. So in someone who is not feeling well and coughs on someone within a close distance, this virus can be spread that way. Also, if you come into direct contact with someone who is sick, that virus could be spread from that person on their hands to you as well. COVID-19 is very similar to the flu. So the symptoms that it typically causes are fever, cough, shortness of breath, and in some patients it can cause pneumonia. So this is a new coronavirus, so we're just learning about how this virus affects patients and how this virus could potentially affect transplant patients. What we do know is that this virus is similar to another common respiratory virus that we talk about a lot, the flu. And what we see in flu and transplant patients is that many patients have a mild illness, so many patients just have fever and cough and do well with flu and are fine at home. And some patients may have more severe complications, such as pneumonia, and may require hospitalization. We're of course concerned about our transplant patients because we know they have compromised immune systems, and so they're more at risk for having possibly a severe complication. And that's why it's really important that our transplant patients take precautionary measures and let us know when they're not feeling well. So the most important thing that transplant patients should do right now is wash their hands. We know that this virus is spread by direct contact, and we know that this virus is easily killed by washing your hands with soap and water or with an alcohol-based hand sanitizer. So washing your hands is the most effective thing that we can do to prevent transmission of this virus. Other things that you can do include, if you're sick, please stay home and don't cough into your hands, cough into your elbow. Also, other things that you can do is that wipe off your surfaces that are commonly used at home. Any disinfectant can easily kill this virus. We've been getting a lot of questions about whether or not masks are protective. We don't think wearing a mask in public is really a good way to protect yourself from this virus. In general, washing your hands and disinfecting surfaces is a much better way to prevent transmission of this virus. We want to save those masks for patients who are actually sick or for the nurses and doctors who are coming into close direct contact with sick patients. So if you have respiratory symptoms such as fever, cough, or shortness of breath, please call us or call your transplant provider. We want to know if you're not feeling well. When you call us, at that point, we'll ask you some questions about how you're feeling. If you're having just some mild symptoms, just a cough or sore throat or runny nose, we may ask you just to stay at home and watch for a day or two and then follow up with us. If you're not feeling well though, or you have high fever or shortness of breath, then we may bring you in to the hospital and evaluate you there. At this point, if you have any symptoms, please call us ahead of time so we know how to triage you and what's the best location to send you to. So what you should do to prepare right now is making sure you have an adequate supply of your medications at home. So call your physician and ask for a 3-month supply of your transplant medications. We don't want you to run out of medications right now. We're also asking that you be really conscientious about washing your hands, either with soap and water or an alcohol-based hand sanitizer, especially if you go out. And we're also asking you to disinfect your surfaces. If someone you know is sick, this is not the time right now to go visit with them or see them. Please stay away from someone you know who is ill. And if you're ill, please call us and let us know. My name is Dr. Meenakshi Rana. I'm the Director of Transplant Infectious Disease. And if you have more questions about coronavirus, please visit mountsinai.org/COVID-19.